One of the biggest issues with ADHD and ADD in general is the stigma. There are so many myths and misconceptions, and this really makes it very difficult for individuals who have ADD or ADHD. So what I wanted to do is break down stigma, look at differences rather than deficit. It definitely can be treated. We can improve people's lives, better outcomes in the long run. There's really good research to support this. And the best first step is helping to break down the stigma related to this, because that helps people go ahead and get treatment.
Maybe I'm ignorant, Dr. Handelman, but couldn't parents just tell their kids to calm down and focus when they need to focus? Is it?
Well, you know what? The analogy to that is when the kid's in the wheelchair, we could tell them to try really hard to walk up the steps.
Fair enough.
But they need a ramp, right? Because they have that condition. Or I could really try to focus and see you clearly or read the material, but without my glasses, I just really can't see.
Yeah, it's a question of taking this seriously.
So it really is a medical condition. We have a lot more research now, brain-based studies showing the brain differences, genetic studies showing it runs in families. It's really a true medical condition. The problem has been, when it comes to hearts and lungs and joints, for hundreds of years, it's been easy to study these and to learn and develop modern medical techniques. For ADHD and mental health, it's really the past 10 to 20 years we've had the right MRIs and SPECT scans and PET scans to really understand what's going on in the brain. So we're moving forward. It's a real condition, though, and people need to get the right assessment and treatment.
If a child has ADD or ADHD, is it a lifelong, I don't want to say problem, but a lifelong concern, or can they do well without medication, for example?
So there's two main issues there. One is, will they outgrow it? And about 30 to 40% of kids and teens will outgrow it by adult life. The second question is, will they need medication forever? And even if they still have ADHD as an adult, some people are able to function well. You see, when you're in school, you have to do math. Even if math isn't your strength and you're struggling, you got to get your math done. You got to get your history done, etc. If you work toward your strengths, which is what I encourage in my approach around differences rather than deficits, if you work toward your strengths, if you're creative, if you're great at marketing, if you're great at art and drawing, if you're great even at mathematics, if you choose a career in that field, then your work becomes enjoyable. You may be able to function without medication. But again, you'd have to review the whole picture.
So we have a lot of people who have been diagnosed with ADHD. A ton. And at the same time, people still debate regularly, is ADHD real? So when we look at ADHD, this has been done, and the core feature here is impairment. When we take individuals and we have that line and we say, you are in the category of ADHD, the reason they're there is because they have a certain number of symptoms and they have impairment in their functioning. And we know that with the right diagnosis and the right multimodal treatment support, people have significant improvements in their functioning and improve their lives significantly. At the same time, we know if people are in that category, there are significant costs to the condition. Human costs, emotional costs, societal costs, and economic costs. We know that when people don't get the right diagnosis and treatment, they're at much higher risk of depression, anxiety, drug and alcohol problems. They're at higher risk of not completing their education and having trouble going further in life. They're at higher risk of not keeping a job when they're an adult, getting into debt, divorcing, etc. And this is very important from the medical side of things, to understand conditions and develop new treatments. It's also tremendously important to help people to understand that these are real conditions. This is as real as heart disease or cancer. This is not just moms who don't care about their kids and single-parent families and social difficulties.
Those who work with children have developed strategies to help families manage the transition from school to summer, as this can be a challenge for all parents, not only those who have children with ADHD.
It's really important to plan ahead for the summer. It's great if you can get your son or daughter involved in creating the structure, have them give their input, and then if you can create a schedule or a routine that's more the summer routine, post it on the wall that'll help your child to adhere to it. Many children with ADHD struggle with social interactions and friendships. I like to encourage parents to promote that during the summertime. That can be through structured activities, like day camps or team sports, or through unstructured activities, things like get-togethers with cousins and friends. ADHD is a challenging year-round condition, not a seasonal problem that occurs only during the school year. Some doctors suggest that you avoid taking a drug holiday during the summer. Parents should speak to their doctors about their options.